Hello, and welcome to our session today on resources for engaging future medical assistants. We're going to kick this session off with a discussion of soft skills needed by medical assistants, and we'll share two scenarios that you can use with students in your program. So here are a few of the qualities that a good medical assistant will possess. Soft skills like teamwork, empathy, and critical thinking are used every day on the job. Now, we dug into the research and came upon study after study that shows the importance of soft skills. And here are a few that stood out to us. In 2013, a study by Millennial Branding showed that 61% of managers and 65% of Gen Ys believe that soft skills are the most important ones you can have in the workplace. A poll conducted by CNBC in 2014 revealed that 44% of employers chose soft skills as the biggest gap in the US workforce. And then research conducted by Harvard University and the Carnegie Foundation all concluded that 85% of job success comes from having well-developed soft and people skills, and only 15% of job success comes from technical skills or those hard skills. Now, health sciences used the power of scenarios for years to help teach soft skills and also technical skills. Sometimes your scenario will include the use of a simulator or hands-on resource as well. Now, here you see examples of two different ways to learn soft skills using simulators and scenarios. The first photo is using a blood pressure simulator on a standardized patient. You could create any scenario you wanted and have one student be the medical assistant actually learning how to take the blood pressure for a specific type of patient, and then the students can switch roles. Now, an added benefit of a wearable simulator, such as the blood pressure simulator, is that the student is also practicing those important soft skills of patient communication. Now, on the right, you can see a geriatric mannequin that can be used in a wide variety of scenarios to teach and practice all sorts of basic medical assistant skills. You could set up a scenario with students working as the medical assistant in a clinic and then have them role play. Now, there are many benefits to scenario-based learning, whether it be for technical skills or for soft skills. First of all, it creates sticky learning experiences. It's something that they'll remember. It facilitates problem solving in learners. It puts your students in new and different situations. Next, it also provides guided exploration to learners. It gives students explicit, thoughtful, critical thinking opportunities. It also provides a safe practice zone for them to gain proficiency and mastery. There is no fear of risk for consequences. Now, it also allows your students to make mistakes, but through feedback, reinforce that right approach. Now is the time to practice so students will know what to do when they come across these situations in real life. They should be building their toolkit of responses and approaches. Now, one very simple yet effective way to help students learn a variety of soft skills are our pathway-specific scenario cards written by subject matter experts. Each card on the back has, each card focuses on a specific soft skill. And we have one card deck that specifically focuses on medical assistant soft skills. We also have them for things like nursing, geriatric, and EMT. But each one has a different soft skill. So there are 19 soft skills, and there are scenarios, key questions for discussion, as well as points of view. Now, we are going to share two scenarios from the deck that you can use immediately, either online or in class with your students. So we know that scenarios are a great way to get your students to interact with each other and the content. So here's a medical assistant scenario relating to communication. Now, this would be perfect to use in a health occupations career exploration lesson. Sometimes it's fun to have your students try their acting skills. So here's the communication scenario. It's time for Adam's relief to show up after working a long 12-hour shift as a medical assistant at a 24-hour urgent care center. He's only slept 8 hours in the last 2 days. He has been vomited on twice during his shift, and he's ready to go home and to get some rest. Lori, his relief, has a history of showing up 20 to 30 minutes late, and today is no exception. Lori shows up 30 minutes late and does not offer an apology or an explanation to Adam. So you could take this, you could assign students the different roles of the person in the scenario and actually have them act it out in front of the class. After the scene is done, then you could ask for those key questions to generate a class-wide discussion. Now, if you use this online, you could have your students role play the medical assistant and use a family member as the other actor. They could record it and submit it to you with answers to those discussion questions. Now, here's another medical assistant scenario, this time focused on teamwork. If you're teaching in a remote environment, this could be scanned and it could be shared in your LMS system. Or you could even create a brief recording where you're reading the scenario and then put those questions out on a discussion forum for your students to weigh in on. These are extremely flexible. So again, we've given you 2 here that you could try and use with your students to see how they do. Now, there are many ways to create short scenarios like these, but you don't have to do it all yourself. You could get industry involved, especially in your local community. Many of you may already use advisory boards that you tap into for your various programs. You could talk to employers in the area you teach. Tell them you're creating a class project and you need some help coming up with some real-world scenarios that involve different soft skills. And you could ask them about recent scenarios that they have experienced on the job. Next, you could get your students involved. You could ask students to create scenarios based on some of their own life and work experiences. Many students are now employed in some of their first jobs. Have them share positive or negative scenarios that they've personally seen or been a part of. You could talk to colleagues. More than ever, schools are tapping into people with business and industry experience to teach. Maybe you have fellow teachers in your school or district who've worked in healthcare in the area that you teach. You could ask some of them for scenarios. You could certainly talk to family members who also may work in healthcare. Asking them what types of scenarios or situations they've seen or been a part of in a work environment may also be a very good source. But if everything else fails, you can always Google it. You could do a keyword search on a term like work role playing, workforce scenarios, workforce conflict scenarios, medical assistant scenarios, and you'd be surprised at what you'll find that already exists out there. You don't have to reinvent the wheel. Now, I searched medical assistant scenarios on YouTube specifically, and I found many. Now, there are some that have patient interactions. Some are scenarios like a day in the life. Some have interview questions for preparing for medical assistant job interviews. So there's a lot of different things out here, but here's just one short scenario. It's about a little less than 7 minutes, all about getting and rooming a patient that you could use with your medical assistant students in your program. Now, we know that videos are a great way to get your students actively involved in problem solving and critical thinking. So again, all it takes is a few of those keyword searches in YouTube and dozens of videos come up with a variety of soft skills in the workplace. Now, not all of these are going to be specific to medical assistant, but if you're looking for some that are just weaving in some soft skills, a quick search will find you many. And of course, they're short, engaging. You could play the scenario. You could stop and discuss it as a class. You could turn it into a writing exercise, something like, how would you handle this? Or what would you do differently? So here's just 4 that I found with one quick search. Now you could upload the links on an LMS system and you could deliver it online, but all of these just happen to be found on YouTube. And we are going to be providing you with a handout at the end of this where you can go in. It has all of the links that I'm talking about in the session today, so it's easy for you to find them. Now let's take a look at some resources for teaching those technical medical assistant skills. But before we begin with the next section on resources, I want to share this Access site with you, and it's at the link that you see above. We have made all of our curricula and product guides available as a resource for every health science product we have. There's a screenshot on the right that shows where to access health science resources at that link. You go to the link and you simply scroll down. And to get to the curricula on a specific skill or topic, you simply click on the trainer or the mannequin that teaches that type of skill. But at that, in those curricula, you will find handouts and assessment tools, instructions, slide presentations. And I'm going to be highlighting several different free resources that you'll find at the link, just to give you an idea. And many of these can help you teach medical assistant skills. And many of these can be adapted for many different types of learning environments, whether it be remote, hybrid, or even in-person learning. So this is a handout from our blood pressure simulator curricula, and it's available at the link that I just shared. One activity you could do is take the procedures and type them into a Word doc, scrambling the order. Now you could challenge your students to put them into the correct order. In Google Docs, you could even set this up so that each step has a correct number associated with it, and it could be auto-graded. We know that hands-on practice really needs to be done in a skills lab for something like this. But what we're trying to do here is get your students all that background information that they need in order to be ready, so that it can save you time when your students are back in person and ready to do those kinds of skills practice. Now, there is an online self-test that I also found that includes audio files as well as knowledge questions with an answer key. There are also audio recordings of those Korotkov sounds that students can listen to as well. And these are just a few of the things that I was able to find online that you could use in your program. Now, here's suturing resources. And this is a handout on the screen that you see from our suturing kit curricula. One thing to note is that for all of the student handouts and activities, there's also a Google Doc version found at the link that I shared for ease of use. Now, it's important to integrate vocabulary development into your lessons so students can understand and can speak the language of the occupation. Now, this is an easy way to include core language arts skills into your lessons. This 2-page handout is from our Suture Kit curricula. Now, in person, there's a slide presentation that also goes along with this information. For remote learning, you could prepare a brief lecture on the terminology using the slide information. You could record it and also share it. The vocabulary sheet information could also easily be turned into flashcards for students to use for practice. Quizlet is just one online flashcard creation website that you could use. And I've included a link on the screen here, which is a free suture flashcard set that's already been created on Quizlet that your students could use. Phlebotomy. The next activity comes from the curricula from our multipurpose venous training arm. It's found under skills trainers, and the name of the product is the multipurpose arm. And this curriculum is Introduction to Phlebotomy. In our lesson plan template, each lesson we have starts with a focus activity. It's a brief activity to engage students and set the stage. So here's an anatomy activity that could be used as an introduction to phlebotomy. Here, your students learn about the veins used in phlebotomy, and they answer some key questions. This could also be shared in an LMS system for your students to access. Here also is a link to a short video that could be paired with this activity on phlebotomy veins. And that video is very short, less than 6 minutes. So you can have a great little mini lesson here to introduce phlebotomy. Now, here's some more content ideas and a few more resources you could use to supplement the lesson content on phlebotomy, or at least bring some of that written content to life. So of course, videos, there's many out there. There are animated vein anatomical tutorials that are excellent in graphics that you could also use. Also free apps. I found several different free phlebotomy apps out there that also may have good, useful information for your students to read. Now, if you're looking for phlebotomy simulation providers, here's one that popped up, and they happen to have a free 1-week trial. So you could sign on for the trial and try their, they have a 12-module phlebotomy course here as well, and it's Simtix. You could also use some of the free apps. For example, I found one here, it's called the Mega Blood Draw Simulator. I can't speak to the effectiveness of all these things, but if you think a little bit outside the box, it might be worth checking them out as potential options just for more resources that you have available to you and your students. For teaching those ECG skills remotely, we have a 3-page ECG interpretation handout that goes along with the lesson on the topic. And this is all can be found with our ECG simulator. There are lecture notes and there are slide presentations in this curricula you have access to. You could prepare a live session delivered to students or even recorded. Or of course, if you're in person, you could lecture as well. Then you could deploy this as a written activity. And in this curricula, there's also an answer key provided to this activity as well for ease of use. If you're working with students teaching ECG skills, you could actually prepare your own training video on lead placement and also rhythm identification if you have a trainer like ours. In the curriculum you have access to, there are PowerPoints and lessons that teach both of these concepts. So I'd really recommend that you go out there and take a look at the curricula and use what you can from our lessons. Also, there are other online sources you can go to as well that show clear lead placement that you could share with your students. And this is just one such example here from primemedicaltraining.com. Here are two online ECG quiz sources that I found, but there are a whole lot more than just these. You can see how students could easily use something like this if they have internet access at home or even on their own to practice these types of skills like rhythm identification. Again, I'm sharing all of these links with you at the end on a handout, so you don't have to worry about writing them all down as we go. Next, we're going to share some free resources available if you have medical mannequins available. Now, to access multiple lesson plans that go with our adult nursing mannequin, you could go to our curriculum link, you click on manikins, adult nursing mannequin in specific, and then the curricula on that. And then it will take you to a folder with all sorts of different lessons on many, many different medical assistance skills. So if you had a medical mannequin, you can, of course, practice many procedures when your students are in person. For in-person or hybrid learning, that's great for the hands-on. For remote learning, you can still help students learn foundational knowledge and watch procedures to learn as much as possible until you can see them in person again. And this just happens to be an activity from our intramuscular injection trainer that we're going to talk a little bit more about. And this was the kickoff activity where they're learning and focusing on the anatomy of the skin and the parts and things like that. You could certainly, because you have access to this, if they're remote, you could post this on an LMS. You could even prepare a demo using a medical mannequin to also post alongside this. If you have one of those venipuncture arms, you could also do a demo using that. Now, as mentioned earlier, demos, live or recorded, can work very, very well for skills instruction. There's many good high quality videos available to you. Now, it's up to you whether you think this is a good idea or not, but there was one video out there that actually showed students practicing intramuscular injections using oranges or other pieces of fruit like bananas. Again, that's something that you can weigh in on whether you think it's an option or not. But we know that in the last year or two with COVID, we've had to be very flexible and think outside the box a little bit on some of our teaching strategies. So that might be one to consider. But again, there's only so much your students will be able to do if they're away from the classroom and skills lab. But you can get them familiar with the procedures at any rate and get that part out of the way. So when you can get them into the skills lab or when they can come back in and you can do that in-person training on the skill, more time can be spent on the practice and less on giving them that foundational information. Now, here's a free resource you can use for acute injury scenarios. This comes from our Nursing Skills Sim Kit, which focuses on adult acute care. And there are 3 different scenarios in the scenario guide from that product. The scenario guide is very robust. Those 3 scenarios could be role played, or you could role play them with an adult mannequin. If you still are remote, you could prepare a video acting out the scenario with that mannequin, have your student watch it, and then share some of the answers from those debrief questions that come along with it. But there are a lot of different ways that you'd be able to use a prepared scenario like this with your students. If you happen to have a bandaging and wound care mannequin like the one above, it could provide a lot of hands-on practice in class. However, if you are still remote, here's one activity you could take from the curriculum from our bandaging and wound care mannequin. And this is a dry, sterile dressing skills checkoff. So all of the checkoff comes in the curricula, and the steps are in order. You could prepare, again, a live lecture and record it using PowerPoints and notes from the lesson, then have your students practice. If they're at home, they would need access to a dry, sterile dressing. Now, this is something low cost that maybe you could even prepare student dressing kits for that at-home practice that could be used at home, sent home. Students could practice on family members. They could record their dry, sterile dressing practice, and then they could submit it back to you. But of course, this works well or best in person in class too. Now, for bandaging, there are many videos that specifically address bandaging for medical assistants or even EMTs. And here are just a couple that I found, but there are dozens more. If your students are able to access bandages at home, again, they could practice on family members, or perhaps you could provide a take-home kit. And the ones I have on the screen here are just examples of one's an amputation and one's a pressure bandage, but there are many others available as well. Now, how to use anatomical models. We know that anat and physiology are prerequisite courses for medical assistants. So I'd like to share a free resource for teaching about diabetes education using our diabetic foot ulcer anatomy model. So the handout that you see on the screen can be found in our diabetes education kit curricula. This activity, or the one that you see here, is an introductory handout. It helps your students learn about key anatomical terms. You could make it available to your students. Then if you have an anatomical model like this, you could do a live demo or a brief recording pointing out all the anatomical parts of the foot. Now you also have access to a robust PowerPoint and lecture regarding diabetic foot ulcers. So you could give your students this assessment procedure and have them practice with someone at home. There are many short videos that you could also post or pair with this assessment checkoff for more information. So you can see how using an anatomical model could lead to a whole series of activities or related lessons on a topic of interest. And I've got an example of just another brief video that you could pair with this foot ulcer assessment, and you could do it hybrid, in person, or even online. So now what? Well, we've got a little bit more to share with you. First of all, RealityWorks has free webinars that are available to you on many different related medical assistant topics that we wanted to make sure that you knew about. All you have to do is go to the link that you see on the screen in front of you, and it will take you to a calendar of upcoming webinars, as well as dozens of archived webinars on a wide variety of health science topics. And you might find some new resources, some best practices, some new information and things that you could use in your course or your program. Now, some other resources that we have a blog, and we have a lot of new content that we are always putting on the blog. We invite guest writers and instructors. We have new product launch information on there. We have product testimonials. Again, how to use things, best practice advice. So a lot of good things on that blog that you might wish to check out. We also tend to be pretty active on many different social media. We have Facebook and Twitter. Many times you'll find other instructors posting things out there, sharing ideas, really dynamic. So if you haven't had a chance to check those things out yet, we urge you to do so. A few other places you might want to look. Health Science Educators Association. This is a group. It's a subgroup from the National Consortium for Health Science Education that you can join, and there's all sorts of benefits to joining. I'd urge you to go out to that website to find out more about the HSEA. Also, this group has a Facebook group out there that is very, very dynamic. Many teachers post questions. They're looking for resources on related topics. You will find that to be a super place to go for talking to other educators like yourselves. Also, the National Consortium for Health Science Education is the premier national health science educator group to belong to. They have national conventions, they have annual conferences, and webinars and all sorts of things available to you. So that's another good place to go for more resources. And then of course, HOSA has a lot of different things as well that you should check out. So at this point, we would like to thank you very much for attending our session today and hope that you were able to find a few things that you could try in your program that will help engage your students and reinvigorate your program. Thank you very much.